Matthew Fenech, and I'm an affiliate consultant on AI in healthcare at a think tank called Future Advocacy. It was great to be invited to speak and participate in this event. I think what our research has shown is that there's a significant amount of work that still needs to be done to talk about the opportunities of these digital technologies, particularly artificial intelligence in healthcare, and particularly to talk to frontline clinicians, frontline health professionals around the potential opportunities that these technologies can bring. So I think events like this are an excellent forum to not only discuss these issues, but get feedback from practicing clinicians about how they would like to apply these technologies. The events like this are extremely important in communicating, as I say, the opportunities, understanding the risks and putting them in context, which is an important aspect of getting more public understanding and more public support for these technologies. There's real opportunities to be had here, and it would be a shame if we miss out on these opportunities because of some misplaced fear about these technologies. That's not to say, of course, that there aren't risks, and in fact, what I spoke about in my talk is about the importance of good regulation to mitigate these risks. So my talk was titled The Regulation of AI in Healthcare, What Should We Expect? And what I intended with the word expect is not only what we should expect coming down the line around regulation, but also what we should expect or demand as patients, as healthcare professionals from these regulatory frameworks. So very briefly, I laid out the regulatory landscape at the moment, what bodies like NICE, what MHRA, the CQC, NHS England are doing, the updated code of conduct for the use of digital health technologies, but also some data about what patients and members of the public want, and some of the potential pitfalls coming up, particularly, for example, how these existing bodies are going to interact with new AI regulatory bodies that are being set up.